Venous drainage in our face area. It can be easily learned with schematic diagram of our face area. Venous drainage in our face area is started with two veins, supraorbital vein and another is supratrochlear vein. Supraorbital vein and supratrochlear vein join together and form angular vein, which is continue as a facial vein. Another venous drainage. It is by retromandibular vein. Retromandibular vein formed by joining two veins. One is superficial temporal vein and another is maxillary vein. That retromandibular vein is divided into two parts. One is anterior division, another is posterior division. Anterior division join with facial vein and continue as a common facial vein, which is drained into internal jugular vein. And another vein from posterior auricular area known as posterior auricular vein join with posterior division and form external jugular vein, which is drained into subclavian vein. Facial vein is drained by lower part of the nose, upper and lower lip via superior labial and inferior labial vein. And this facial vein via deep facial vein drains into pterygoid plexus, and from pterygoid plexus via tributaries it drains into cavernous sinus. This deep facial vein is a valveless vein. Another vein from supraorbital vein drains into cavernous sinus. This is known as superficial ophthalmic vein. So any infection below the nose, upper and lower lip via those veins can drain into facial vein, and from deep facial vein it's drained into cavernous sinus and can cause cavernous sinus thrombosis. So this area is called dangerous area of face. The things we see in flowchart is that supratrochlear vein and our supraophthalmic vein join together and forms angular vein, and that angular vein is continue as a facial vein, and this facial vein join with anterior division of retromandibular vein, and form common facial vein. This common facial vein drains into internal jugular vein. That facial vein is drained by superior labial vein and inferior labial vein, and the facial vein is by superficial ophthalmic vein and deep facial vein drain into cavernous sinus. So for this reason, this dangerous area is face. If there is any infection in dangerous area of face via superior and inferior labial vein, then deep facial vein, and then deep and superior ophthalmic vein can causes cavernous sinus thrombosis. And another is retromandibular vein. Retromandibular vein is formed by superficial temporal vein and maxillary vein that form retromandibular vein, and it is divided into anterior and posterior division. Anterior division and posterior division. That anterior division is joined with facial vein, and posterior division joined with post-auricular vein. And form external jugular vein, which drain into subclavian vein. Thank you.